Welcome to Well Run a Mama's YouTube channel. My name's Sherry and I'm joined by Tori. We're both home birth midwives in the Las Vegas area, and today we are talking about
PROM, not the fun one.
not the
like
put
the
on your
dancing.
fancy dress and go dancing, but we're talking about premature rupture of membranes.
It's not the funnest thing. It's not my favorite.
About 10% of individuals have their water break before going into labor. Why do we care about that? What are our protocols? What do we follow? For starters, hospitals and physicians handle things very different than midwives do when it comes to premature rupture of membranes. And so if you are having a hospital delivery,
Probably doesn't apply to you.
Ignore this.
Ignore it. Close your ears.
You're not going to win. They're going to want to see you deliver a baby within, is it 18 hours now?
I think it's like 18. 18 to 24 if you have a really nice doctor.
Yeah, it's like 18 to 24 hours once you've had that premature rupture of membranes. So usually premature rupture of membranes means your water breaks. The questions that your midwives are going to ask you: how much? What was the consistency? Was it clear?
Color, yeah.
And is baby moving?
Is there a weird
right?
smell?
Yes, those are the questions that we're going to ask. Routinely, individuals go into labor within 24 hours of that happening. That's pretty common, but it doesn't always happen. Sometimes it's taken up to 4 days for my clients to go into labor, or sometimes we make the call to go in depending on what people's comfort levels are.
And I mean, again, we're following certain protocols. So if we're seeing something different, if we're seeing a signs of infection, a fever, something like that, that also might make us go in sooner than that.
Well, the things I want to talk about are group B strep a little bit, and then I also want to talk about what do we have individuals do when they have premature rupture of membranes. Generally, we want somebody to monitor themselves for a fever every 6 hours, just to make sure you don't start running a fever. That would be a sign of infection. We also tell individuals no intercourse, nothing in, no vaginal exams. We want to make sure that as little amount of risk to the baby as possible.
We would like to not increase any types of risks by pushing any bacteria up there.
We generally encourage our clients to take a probiotic in their last trimester, but if you're not taking a probiotic, we encourage you to be eating foods after your membranes have ruptured that are fermented or taking a probiotic. The other thing that we may or may not request you to do would be to take vitamin C, at least 1,000 milligrams, as well as possibly even garlic, depending on relationship, history, status, all of that thing. Now, group B strep is something that most individuals test for. Sometimes if you have a high enough strain of group B strep, sometimes that could have been what caused your membranes to rupture. Sometimes when it comes to GBS, depending on your midwife, she might have some different protocols that she'll have you do. So make sure you talk about GBS protocols. But generally, we don't really want to go much more than 24 hours with a GBS positive status when it comes to that, because we're going to assume that there's a reason why you're not going into labor. What I do find is that people always think their water is going to break because they've seen that in the movies. So I do get like I'm having these contractions, but my water hasn't broke yet. And I'm like, I don't need your water to break to come to your birth.
In labor.
People, I think when their water breaks, they feel like now they are on a little bit of a clock. And you are, but not as bad when it comes to a home birth midwife.
For sure.
If you were over in Europe and you went to the hospital and your water had been broke, they would send you home. That used to be what we used to do in the United States. However, liability has changed that, and now most hospitals will admit you and induce you once your water breaks. The problem is there's a lot of inductions that fail because if baby's not ready to come, that's a whole other sign. Maybe there was a high GBS strain or something else that happened that caused that water to break. Sometimes we also see where maybe a 4-bag broke or there's a high leak in your bag, and we treat you like your water has broke, and then you go to push out a baby and your water breaks, and we're like,
again.
Oh. Most of the time we do know when water breaks because you feel like a popping sensation or you feel a gush, or generally your water breaking is not painful at all. I should start to say I do have a lot of individuals who worry that it's painful. Yeah. It can be intense if it makes your contractions pick up. However, water breaking in and of itself is not painful. That's what we're doing. We're monitoring for fever, and we're kind of maybe giving you some preventative herbs or minerals or vitamins that are going to prevent any kind of fever from coming on so that you're not infected. And fetal movement. Fetal movement is always our number one. If we've got a baby that's moving well, we're generally not worried about anything.
Probably should side note too, if your water breaks and you are not term, make sure you call your midwife, because that is a totally different scenario.
Term being anything after 36 weeks. So if you suspect your water break, you should always call your care provider if you think that your water broke. But for sure, if your water breaks prior to 36 weeks, so that arrangements can be made. We check in the office for that, so we
use
know
that, yeah.
before sending anybody in. One of the worries and concerns about premature rupture of membranes would also be cord prolapse, meaning that the cord comes before baby. So if any time during your labor your water breaks, and if you feel something hanging in your birth canal, you definitely want to call your midwife. If you remember this, awesome. Or if your birth team remembers this, going in a hands and knees position or a child's pose position, and then calling right away. That's really important when it comes
Really,
to a
really
cord
important.
prolapse. Very, 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 very uncommon, but just a tool for you to have. If you have any questions about premature rupture of membranes, things that we missed maybe in this video, ask us down below. We look forward to visiting with you next week. Welcome to Lifestyles of the Rich and Famous.
Calm down, Moira.
Love that for you. Well,
One more time.
for everyone in the back of the class.
And you accidentally get splashed because you weren't ready for it because you
'Cause you're
thought it
like-
was gone.